Hello everyone, it's the 19th of January 2018 in New Zealand, and I want to talk to you about the myth that started to crop up around the time that the choice-based present trend became advocated. And it became advocated on a number of premises, and the first one was that the mother knows best, that because we carry our babies, we know our babies better than anyone else, and that's true. They grow inside us, and therefore the fact that we're with our baby 100% of the time, that therefore we know what's best for our baby. When I started to hear that in the late 1970s, I thought to myself, I'm a mother, you got to be kidding me. So all of you out there that are mothers, do you always know what's best for your child? Are we always doing the best thing for our children? That's something that we know that's not accurate. And during pregnancy, it's not any more accurate. And during birth, it's not accurate either, as I talked about in another of the Debunking Myth series about positions in labor, that often women get into positions that make them feel better, that don't actually help their baby become born. So when we ask this, when authors or speakers or natural birth advocates or midwives, because doctors actually don't say this, and this is one of the conversations we have. Do we go to a midwife because a midwife will believe in my choices, will believe in my feelings about this, will honor those, and the doctor is going to say, no, I want to do these assessments and monitoring and procedures just in case. So women are in a bind. On the one hand, they want to take control over their pregnancy and birth as much as they can. And on a subtle and not so subtle level, you have the medical profession basically saying we need to do assessments and monitoring and procedures on pretty much everybody. And then you just become a cog on an assembly line. Or a midwife who basically appears to be just saying, well, let's go along with you. You know, this is your birth is unique. The baby lives inside you. You know what's best for your baby. You know what you want at your birth. I want to give you that experience. So let's go that way. And that sounds very, very inviting. But there's a myth to this. Women, mothers, don't always know what's best for their baby. It's definitely true that if you have a baby growing inside you, and just remember that you don't feel the baby move at conception. You don't feel the baby move at 8 weeks, which is 2 months. You don't feel the baby move at 12 weeks, which is 3 months. Most women don't feel the baby move at 16 weeks, which is 4 months of pregnancy. So we have all lived through at least 4 months, and some women don't feel their baby move for sure at 20 weeks, which is 5 months. Certainly women who have been pregnant before, they're more attuned to the tiny, subtle bleep, 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 which is the first movement that you feel, but it's not like the movement that you feel when the baby's really rolling around inside of you from 36 weeks onward. So for at least 4 months or 5 months of our pregnancy, our sense of being pregnant is not that we necessarily have this aware connection with our baby through our movement. Sometimes if a problem occurs that ends up with a miscarriage, women will have a sense of that without a doubt, and they'll have a greater sense of it once they consistently feel the baby move, and if the baby stops moving for an extended period of time, although all babies stop moving for extended periods of time. But there is no doubt that there are some women who have said, I feel that my baby has stopped moving. And this skill has become more prevalent since counting baby movements began to be one of the assessments that women could do for themselves. Because sometimes it is an indicator that something is the matter with the baby. Some people don't pay that close attention, or they have a baby that isn't a baby that moves a lot. You can hear women say, oh, this baby is just constantly moving. And the same woman could say of another pregnancy, well, this baby just doesn't move as much. And some babies don't. Besides which, as you get towards the end of your pregnancy, babies slow down and stop moving. They go into sort of a hypnotic, suspended, sleepy, dreamy state as they too prepare for the labor and the delivery. So when we say that mothers know best about their baby, we have to ask, why is that being said specifically around pregnancy and birth when we absolutely know that is not accurate at any other time in life? Once we have children, there is no mother, and I'm talking to you, you know that. There are lots of times we don't know what's best for our baby. In fact, there are lots of times we do things that are just counterproductive to our children, and we don't always mean to do it. How many mothers out there, me included, have gotten unnecessarily angry with our children over trivial things? Anybody who hasn't, please stand up now and tell me to sit down and shut up. So mothers don't know what's best for their baby. What we are all trying to do, to the best of our ability, is do the best we can for our children. But even that is a stretch of the imagination. We have many families that are highly dysfunctional families, whether it's from alcohol, drug abuse, prescription medication abuse. They did a study once, of a longitudinal study of thousands of children who were living in abusive situations. 100% of those children knew they were being abused. That's obvious, isn't it? We know when we're being abused. 80% of them grew up to be abusive parents. That should give us something to think about. So mother doesn't always know best. We don't, as mothers, always do the best either. And so we have to debunk this myth. Does this mean now that you as an individual pregnant woman should go into your doctor claiming, well, I know what's best for my baby because I'm the mother? The way that Birthing Better families approached the obstetrical model about choices in childbirth, if those choices were going against or rubbing against the standards of care that either the doctor or the hospital had, when many of us had very medically high risks and were asking to achieve a less medical birth given those high risks. The way that we approached the medical profession was to say, I don't want to put my baby or myself at risk. And therefore, as long as there are no factors that indicate that the issue or the issues that I have or the baby has are actually really unfolding to become a problem, then I would like to continue to have the birth, a less medical or more natural birth, as long as all the indicators show that I and my baby are fine. Now, this may sound like both a long-winded statement, but it's also important. Your care provider sees many people, and so they're dealing with lots of people's viewpoints on things. When you go in and you say, I want to work with you, that we both know that there is one or more issues impacting my pregnancy, my health, and my baby, and I am choosing to try to do this birth with less medical care. And I know there will be assessments. I know there will be monitoring. But as long as the indicators show that this issue or issues are not becoming a problem, then I want you to be okay with letting me continue with a birth that is less medical. And I want you to know that of the families that I worked with and the Birthing Better families who told me stories of approaching their obstetricians with something like that, that all of the obstetricians were absolutely fine assessing and monitoring as long as the issues did not become a problem. They did not require or invite more procedures or interventions. So everybody birthed better because everybody was on the same page. And the same page was, I'm not willing to put myself or my baby at risk. However, I can't just assume there's a risk in the sense of just say, okay, just because there is an issue or issues, I'm going to just have every type of medical care in the world. What I want to do as an individual is to have you assess and monitor because that's what you're good at as an obstetrician. And as long as all the indicators are fine, then I want to go forward with this as natural a birth as possible. Now this goes true for women who have medically high risks who are approaching midwives. Not the midwives so much in the hospital because they're bound by the same standards of care as an obstetrician is. And midwives in the hospital don't give you continuity of care. They're on shift. And their role as midwives is to assess whether the issue or the issues you have require more medical care. So it's perfectly reasonable if you have staff in the hospital when you get there that you repeat the exact same thing to every staff member. It seems like it's long-winded, but every staff member, if they know that what you're saying to your obstetrician is, I am aware that I or my baby have one or more issues, and as long as the assessing and the monitoring indicate that these issues are not becoming problems, then I would like there to be less procedures that aren't perhaps necessary. If the issues are becoming problems, then we certainly will talk about the procedures because I will not put myself or my baby at risk. And therefore, every staff midwife or every staff obstetrical nurse knows that you are coming in being responsible, and they will help you try to achieve a less medical birth. But I'm talking about approaching your home birth midwife if you have an issue or issues, or if an issue or issues arise during your preparation or during your home birth. It is really important that you say to your midwife, because their profession is online by attending you out of hospital, even if they are integrated into their health system. It's not that they individually may be at risk, it's that the service of home birth may be at risk if the statistics show that there are greater risks of having out-of-hospital births. So your responsibility as a mother, in terms of this debunking the myth about mothers know best, is for you to say to your midwife, I have an issue or issues, I or my baby do, and I want you to know that I will not put me or my baby or you at risk by being foolish about this. If I feel at any time that I feel that those issues are becoming problems, then I will let you know. In other words, as a birthing woman, when we became skilled as birthing mothers and fathers, using Birthing Better skills, large part of why these skills were developed was so that we could distinguish within ourselves whether the issue or issues that we actually had were becoming problems, and to try to prevent or reduce those issues from becoming problems. And we knew that the two greatest areas of where they became problems was a delay in dilation and a delay in second stage. So if we could birth effectively, then many of the issues that we or our babies had were greatly reduced from becoming problems because we birthed effectively and we labored effectively and we birthed effectively. So when we approach a home birth midwife, we have to reassure our home birth midwives, this is our responsibility, that if we have issues, that if we feel that issues are becoming problems, that we will speak out. And this is important because when we talk about mothers know best, the one thing I can tell you from working with Birthing Better families, particularly in an out-of-hospital situation, although this occurred in hospital as well, you could be working with a woman could be laboring, and things could look very bizarre. And you'd think, is that normal? You don't always know what's normal. And she would look at you because she was highly skilled and she would go, everything's fine. And everything would be fine. On the other hand, there were women who just looked fine. Everything, every indicator was fine. And suddenly the woman would go, something's not right. That was always true. It didn't mean that something not right meant the death of the baby or the mother. But there is something that happens to women in labor. They can tell you whether their labor is delaying, is just going on and on and on. Women will say it. I'm having the same contraction over and over and over again. That's telling you that the labor isn't progressing. Women will say to you, I'm having pain in my right hip. She's telling you that baby is pushing and is stuck in there. A woman will say to you, I don't feel my baby's coming down. She's telling you that. So in the labor itself, often women will tell you whether they feel this is progressing or not, and whether even if their baby's okay or not. And so it's not that mothers don't know best, but it's also not that we always know what's best. What we know is that the more skilled we are as a mother, the better we are. And that's true whether we have children or when we are giving birth. So we'll just continue on this series. And as I said in the description, I didn't just come out of this and say, okay, let's debunk the myths. It was from questions that all of us had as mothers and fathers. There were simple questions, as you can read in the description. Now, once again, we just want you to know that to grow a skilled birthing population requires people like you to want yourself and your friends and your relatives who are pregnant to become skilled. We know that our Birthing Better is unique because it was developed by us as women and men and used in all births. But it doesn't matter what skills you use. There are lots of good skills-focused methods out there. What we're saying is we just want everyone to have a good set of skills to birth their baby, because it is an infrequent experience and we should get the most out of it. And we get the most out of it by feeling competent and confident, and that comes from being skilled. So please like our Facebook page, and please pass on our website, www.birthingbetter.org, and we'll see you tomorrow. Bye-bye.